Okay, well, hello everybody. My name is Christine Givant, and I am one of the founders of Libido Compounding Pharmacy with my brilliant business partner, Deb Hubers, who's not here tonight. I'm the clinical half of the team. We've been doing these kinds of presentations for the women for years and years since we first founded in 2007. And the guys just didn't get a lot of love. And then Dr. Silberman came along and we developed this Boys and Brew presentation, which is our second presentation now of this PowerPoint. That first one was really well received. We think the guys need love too. There's a lot of good information here for you tonight, guys. So ask your questions. There's a chat icon below. You can click on that and type in a question and it'll get read to the doctor. Doctor or myself will be able to answer it for you. And this is your night. There's nothing we haven't heard. There's nothing the doc hasn't heard. Get your questions answered. There's no bad question. I know there's a lot of ladies in the house too, so ask your questions as well. If everyone could please mute their audio and their video. There's a lot of anonymity here, so don't worry. We don't see you. I don't even really know who's here. We're just looking at the screen. At the end, there's going to be a drawing. I know the Center for Health and Wellbeing, where Dr. Silberman works, is giving away a couple of Myers cocktails, which you'll want to hear about those at the end. We're giving away a little bit of Libido swag, baseball hats, things like that too. But you have to be present to win, so stick around. So grab your beer or your beverage of choice, whatever that may be, and settle in for a really informative talk. It's a fun talk, it's an informative talk, and we have an excellent expert here tonight on this topic, Dr. Adam Silberman, who I've had the great pleasure of knowing and working with for years now. So I'm going to turn it over to him. I'll be here. I'll be jumping in and out. Again, it's an informal talk, guys. Ask your questions. There's no stupid question, as they say. And tonight's your night. And then I'm going to turn it over to Dr. Adam Silberman.
Hi, everybody. Excited to get this information out to as many people as possible. And like Chris said, any question you have is a good one. We're probably have heard it before and happy to answer it at today's visit for sure. So here we go. Boys and Brew to a life of epic manliness. That is what I hope for all of you as we age together. Unfortunately, sometimes through the aging process, it can kind of leave us feeling a little bit down in the dumps, kind of like this slide, because you got divorcee there with the convertible, but the bottom right will work for Viagra. you've got flabby, you've got moody.
It's not fun when you're all of those on one day.
Yeah. And, I know many of us have maybe, looked.
I'm on this Zoom call for just a little bit.
Maybe.
Do you need anything?
Well, can someone mute their audio, please?
Yeah.
We can hear someone talking.
Good asking, though. I like that. I'm on a Zoom call. That was great communication. I like it.
Yeah, I love it.
I'm on a Zoom call. Do you need me for anything?
Yeah.
I love you. It's perfect. But yeah, sometimes, we'll look in the mirror and we'll think like, man, like I got a little bit more around the midsection than I used to. I'm kind of losing my hair and notice that I'm getting a little irritable, or maybe don't have the same, lust for life that I had maybe only a few years prior. A little bit of self-doubting is the one that I probably relate to the most sometimes. Maybe that's not what people would think coming from a doctor, but it's just the truth. And, these are all signs that something could be, awry hormonally. And it's not just in your head, or it's not just a lack of effort on your part. So, one thing we think about in our lives are kind of like, where are you feeling, like you're not having enough support, right? Are you tired? Are you gaining weight? Are you getting hurt more often for no reason? The joke is do you wake up from a night of sleep and you're hurt? Like you're like, what happened? I fell asleep and I woke up and I've got my neck hurts or my shoulder hurts or my back hurts. And you're like, what did I do? Are you, athletic and noticing that it takes a little bit longer for you to recover between workouts or competition? Or even just playing with your kids, noticing the next day you're just a little more sore than you used to be. Are you still, competing either with yourself or in organized sport, and noticing that your performance is changing. These are all signs, that something could be going on. And then, of course, the elephant in the room that isn't really the elephant anymore, but are you sort of losing your mojo, which isn't just your sexual desire, but your gusto, your passion for life, your passion for your projects, for what you're doing. Like, are you not finding the same amount of enjoyment from the work you did, or the exercise you're doing, or the hobbies you were into, or even stuff like food, or looking at the sunset, or is just the color kind of gone from the scene a little bit. Lost decision-making abilities. We hear that a lot in our executives, that they start to just doubt themselves, right? The self-doubter. That's something that kind of comes on and could be, could be something hormonal, absolutely, that we may want to support you with. And then, certainly the libido concerns, right? Decrease in morning erections, desire, lack of desire, changes in desire. And, some of that absolutely is natural as we age, as our responsibilities in life come up and down. But at the same time, maintaining morning erections, regular morning erections is one of a few physical exam findings, we should say, that indicate that your hormones and your longevity program are actually, working. And when you lose those morning erections, that can be a sign that you might need some support in a number of different ways. Here we go. And we've got, a growing body of evidence to show that low testosterone is becoming much more prevalent in our male population. I will save you the citations behind these two bullet points, but there are numerous, dozens, that demonstrate that, it's approximately 40% of men over 45 years of age are actually experiencing low levels of testosterone. And this doesn't mean suboptimal. This means lab low. Which is a pretty shocking number when you think about, okay, I wonder how many people are experiencing suboptimal levels of testosterone on top of it.
I've even seen this with younger guys now, and I think it has a lot to do with the American diet. And a lot of the food being full of estrogens and hormones. So yeah, it's definitely showing up in the younger crowd too.
Yeah, absolutely. And it is concerning. That second bullet point really kind of hits me because I'm under 45, and looking at almost 1 in 5 with low testosterone. That's a high number, and we're not seeing in the discussion points of these studies commentary on how this is improving. It's really commentary on how we've seen a progressive decline in testosterone levels in men that is abnormal to what was happening before. So yeah, like Chris mentioned, it can lead us to the idea that potentially there are some environmental factors that are playing a role in this because we see it as a whole across the United States.
Hey, Adam, there's a question. What would you consider low or suboptimal testosterone?
Yeah, so we'll get to that in a couple of slides, but I put 575 or below. I consider low because there was a study that looked at cardiovascular disease risk in men, looked at about 30,000 men, and they noticed that men whose testosterone levels were below 500 had like a 20+% increase of cardiovascular disease. So I put that 575 marker as my low end of what I would consider normal because of that study showing that when people had levels above 500, it showed that they saw a significant improvement in their cardiovascular health. Yeah, so that's the number that I use. And it's a number that, the Academy for Anti-Aging and Restorative Medicine uses. It's the number that the IFM also uses. Somewhere between 500 and 600 is usually about where most integrative or functional medicine groups will put the number to. But these studies are looking at numbers like below 300, basically. So it's pretty shocking. So here's a little bit of information about myself and Chris. I am faculty on the School of Family Medicine and Public Health at UCSD. I also am a naturopathic doctor here at the Center for Health and Wellbeing, which is an integrative clinic in Hillcrest. We have a wide range of providers here that can help you under the insurance umbrella: acupuncture, chiropractic, marriage and family therapy. We do IV therapy here. Of course, primary care family medicine. And we have 6 naturopathic doctors now that can all sort of work as a team to optimize your health and well-being, help support you if you're in an urgent health crisis, and really kind of be here for you from start to finish. It's a very unique place. I've never worked at a place like it before. And, the reason I do these types of talks for the center is because I believe in it. Chris and I, like we spoke about, Chris and I have been involved we've had a relationship since 2013. And it's been very helpful to work with Libido as a compounding pharmacy to create really like safe, high quality, individualized solutions for my patients. It's really allowed me to do the medicine that I want to do, which is the N of 1 medicine, the personalized medicine. And without having partners like Chris to create medicine with, it's impossible. So yeah, I feel pretty lucky to work with someone like her.
Right. Likewise, Doc.
And then we also have a global virtual concierge practice called Blueprint Wellness for individuals that really want a high touch program and support. People that maybe are frequent flyers or executives, their time short. They want a lot of one-on-one time and attention. We kind of have a bit more of like a kind of take it to the next level, cash-based concierge practice that we limit to a small subset of families every year, so that we can provide them with that one-on-one attention that they need. So try to kind of, between the work at UCSD and here at the clinic and the concierge practice, I try to kind of balance my time so I can meet all of my patients sort of where they're at in terms of the time, energy, and attention that they may want. These are our sponsors. And now let's get into a little bit more of the nitty-gritty. I want to make sure you guys leave the talk not just with a teaser, but with some tangible data that you can actually take, not just to me, but to your doctor. I hope that after this talk, you'll be able to go to your doctor and be like, hey, I'm interested in getting these labs tests done. This is why, and hopefully you'll be able to, educate and empower them to support you too. So what we're talking about here is a concept called Andropause. That's sort of the medical, 3-syllable word for low T. It's as you can read, right? It's a decline over time of your testosterone. We see it primarily begin to happen around age 45, but there's a variability there. And like we saw on the previous slides, we can see progressive decline in testosterone in men, as early as their 20s. We'll talk about some of the reasons why we may see that, but about 45 is when, an otherwise healthy guy would be like, yeah, it's probably time for you to get your testosterone checked, at least as a baseline, and every year from that point onward, so that we can catch a trend as to what you're doing. Depending on your family history, your genetics, your lifestyle, we'll see a different level of decline over time. It is the decline of testosterone at a certain rate, is still considered a natural process of aging for sure. However, we are living longer and longer than we ever have before. And so what we're finding in the world of longevity medicine is that if we do provide hormone support for men, they live healthier longer. They don't just live longer, but they live, their health span lasts a longer period of time. And I think nobody wants to live to 120, unable to enjoy the things they're doing. And that's really what we're learning about as we're growing. And we're in a really interesting time for this type of research. And Chris could probably attest to this too. We're starting to see the outcomes of these 20-year plus clinical trials on using hormone replacement therapy in men and women. We're starting to see the outcomes data. Every year, we're seeing a different one ending. And it's changing the way we think about utilizing hormone replacement for this idea of health span, of not just lifespan, but health span. So you guys are in a very unique time, because even 5 years ago, there really wasn't a lot coming out yet. And now we're just seeing bang, bang, year after year, these clinical trials showing that, we may want to consider using these types of therapies in men at earlier ages to give them the health span that they're looking for as they age. What else we got? So here's some, the typical, like if you were to see the low T ad on television. I don't really watch TV. I watch a little Netflix with my kids. But I've heard the stories from the guys that come in my office. They're like, it's like, they just riddle off these things that are like, the world's ending for you. And it's like, you probably have low T. Go talk to your testosterone doctor or whatever. But
that is everything.
Yeah, but it's true. It's like, low sex drive, we talked about difficulty with, morning erections or getting an erection or maintaining an erection. If you've got low sperm count, absolutely. We're looking at testosterone as a possible contributor to that. Usually that sperm count is associated with something happening in your pituitary gland, which we'll talk about in a little bit more detail. Unexplained hair loss, hot flashes, they can happen in men. Contrary to popular belief, it's actually more common than you think. Changes in your size of your testicles, diminished lean muscle mass. Now, this is an important topic, because one thing that we're finding that is a key marker for healthy aging is your muscle mass. How much muscle you have on your body before you hit age 50 is showing to be a very critical biomarker to how well you're going to age for those next 30, 40, 50, I think 70 years. And then obviously the opposite of that is seeing an increased body fat. We're about to pick up a bioimpedance analysis machine that we're going to have here at the office, where basically you stand on it. You guys might have seen them at like the YMCA or something. You stand on them and you hold the two things with your hand, you put your feet down, and it gives you a ratio of your body fat to muscle. And we can use that to track performance and how well we're doing with patients, not only with hormone therapies, but also with the exercise routines that we're doing and the nutrition plans we're giving them. So we should have that within the next couple of weeks, and it's gonna elevate our game even more on how specific we can get with patients. Certain biomarkers that are associated with unhealthy aging. So elevated hemoglobin A1C, which is a marker of your average blood sugar. High blood sugar on average is unhealthy, absolutely unhealthy. We're looking at, bone density issues, right? Low trauma bone fractures are also very common in guys with low testosterone. That's like you're playing intramural soccer and you go to pivot, and next thing you know, you bust your toe. Or like your kiddo steps on your foot and you shatter a bone, that kind of stuff. And bone density is an issue for men too. And then problem sleeping is something that most people don't think about. It could be associated with testosterone. Fatigue, people obviously, talk about, and then motivation, lack of motivation, depression. But I like to point out particularly the problems with sleeping, because that's something that some people wouldn't necessarily directly draw a reference to hormones and in that context. And vice versa, poor sleep can impact your testosterone, which we can talk about. So, what do you get, from testosterone? We're going to talk about all the stuff without. And this is what testosterone does for you. It gives you that gusto. It allows you to build the muscle mass that you need to age well, and it definitely impacts your sexual ability and ability to enjoy sex. So to mount an erection, maintain an erection, and to climax as well. So, when you think about what's important in your life, in all of our lives, sexual health is very important for us. It is one of the core foundations of health, alongside with stress management, with movement, with nutrition, right? With a connection to spirituality that anchors individuals as they age and as they age well. It's not necessarily always put in the typical pamphlets of those types of lifestyle therapies, but because it's kind of taboo for people to talk about it. And I hope that after tonight's talk, it encourages you to have those conversations openly with your partners and with your doctors, so that sexual health can be valuable to you, be a positive thing in your life at every stage of your life. Right? It's kind of a bit of a passion of mine, but So here's a little bit of a science breakdown of how testosterone is made in the body. And it's important because we use therapies to impact each level of this process. And with an appropriate workup, a comprehensive workup, we can get an idea of to where in this cascade of events your production is being inhibited or impeded. And it's not as simple as, it's not the same for every man whatsoever, quite the contrary. So, the majority of testosterone, as you would probably guess, is made in the testicles. And I will answer a question right now that some men may or may not want to ask. But if you do take testosterone replacement cream, you do not put it on your testicles. Don't put the cream on your testicles. 95% is made in your testicles if you're naturally producing testosterone. Like I mentioned, the optimal levels range from about 550 to 800. I put that lower end above 500 because of the studies that I noted to earlier about the improvement in cardiovascular health as a result of testosterone levels above 500. But as you can see here, your testosterone production actually starts in your brain, in the hypothalamus, which is a specific part of your brain. So there are therapies that we can use to encourage activation of the hypothalamus that then communicates to the pituitary, which is a gland that kind of sits, I guess, in your cranium, but it's not technically part of your brain. It spits out hormones. So then there can also be a problem in the pituitary. Many times with traumatic brain injury, athletes with history of multiple concussions unfortunately are military, right? They've experienced a number of concussions to the brain that can potentially negatively impact pituitary function. Then your pituitary sends out hormones to your testicles, and then your testicles make sperm and they make testosterone. Then you've got this feedback loop. So the testosterone leaves your testicles, goes into your blood, and then recommunicates with your pituitary gland, your hypothalamus in your brain, and says, we've got enough, we've got too little, and the process kind of feeds forward. It's like, okay, let's make more. And there can be functional or disease, like full-on pathologic imbalances in this process that we can identify on lab work and proper physical exam. Let's see what we got next. So here are some of the things that we know. So each one of these line items is associated with a clinical study. So once again, just kind of save you the bottom half of the slide being full of references. I'm happy to show them to you when you come into the office, I guess.
You did the heavy lifting, Doc. You read all the studies.
Yeah, they're tiny, but just put it this way: like I spend too much time reading up on this stuff when I could probably be sleeping or, I don't know, writing poetry to my wife. But that might end up happening sometime soon. Too.
Right.
So what we're seeing here, so each line item is associated with at least one clinical outcome study. So testosterone can help fight depression. I can't tell you the number of patients I've seen that have been referred to me by a psychiatrist or a psychologist, man or woman, that it actually is their hormones, their testosterone. And then once we kind of dial that in, they're like, man, I feel like a whole new person. How come I spent the last 20 years never looked at this? Well, it was because they were in their 20s and 30s and no one ever thought, right? It improves your body fat to muscle ratio, which what we talked about again is a very salient biomarker for how well you're going to age, especially after the age of 50. We do see a decrease in cardiovascular disease when testosterone levels are above a certain range, 500 in men. We do see it, right, like an improvement in bone density, which is the opposite to what we saw on the other slide of osteopenia and low trauma bone fracture. We see improvement in libido, erections come back. There is, I wrote may here because we do see some evidence showing that individuals who have testosterone levels within a certain range as they age have a decreased likelihood to have Alzheimer's disease and other cognitive decline, but there isn't this kind of like one-to-one linkage. So that's where the mays come. It's the same thing with the strength in your heart and the depression. Like at the end of those studies, they always say, well, there are other factors that play a role there. Testosterone is one of them. But it's helpful. So cognitive ability, it absolutely improve your gusto, which is your competitive nature. Does increase your tolerance to risk taking. So that's something that we keep an eye on for men. And it's actually a warning sign that sometimes I see when guys come into me from maybe another clinic and they might be on too much. They're just like, whoa, doc, I feel like I'm a loose cannon, kind of. So, there's a healthy and unhealthy kind of piece there. This is a joke that it can help you woo a woman, but there is a yeah, right. It's like, maybe that's just like a nerd joke. Maybe that's like a nerdy joke, but Chris is smiling at least. But actually there's a study. I don't, whatever. I just don't want to put it in because I thought it was interesting. There's a study that shows that when men's testosterone levels are above a certain point, they secrete specific pheromones that women will, or our partners, it's actually not just women, it's other individuals that would be attracted to them will smell and then become more attracted to them. So like, it's almost like with your testosterone levels above a certain amount, you're secreting these scents, like the scent into the world that is magnetic to you in terms of a partnership. So, it was in kind of a top tier journal, but I just wanted to, I thought it was kind of
throwing that out there.
Yeah, I just throwing it out there. And look, I want to believe it. I'll believe it. Yeah. And then the other piece, kind of like the increased tolerance for risk taking, you've got this idea of increased, this idea of dominance, this idea for this power position, this kind of alpha male feeling that can be very powerful and supportive and helpful in people, particularly in like their work environments. But we want to keep an eye on it because sometimes, you got to pump the brakes a little bit when you go home to the family, right? Some of the myths that I hear again and again and again about testosterone replacement therapy is that, it results in antisocial behavior, it makes you angry, that it causes prostate cancer, and that it causes heart attacks. When you notice in the other slides, and I probably talked about the studies ad nauseum because that's where I draw my line for my low end marker, but we actually see a decrease in cardiovascular disease risk as men's testosterone rises above 500, a decrease. There were some studies from the early 90s that resulted in some warnings about using testosterone replacement that have subsequently been debunked. And you'll see them, you'll read them when you do your research. They're out there and they will always be out there. But every year, like I was talking about earlier, every year we're seeing these longitudinal studies about men who have been on testosterone replacement therapy, keeping their levels within a healthy range. And we're seeing decreases in their cardiovascular disease risk, which is the number one cause of death in men. So especially if you have a family history of cardiovascular disease, this is something to kind of think about. And like I said, get your levels checked. And then, this idea that testosterone causes prostate cancer is another one of these things where there were some studies that looked at this idea back in the early 90s, and it's been debunked too. Testosterone replacement therapy does not cause prostate cancer, especially well-managed testosterone replacement care. So here's some data that I was saying 20%, it's actually 30%. Under promise, over deliver, right? Isn't that what they say? And we're looking at 550. So that was it. So keeping your levels above 550, this is what we're seeing in a number of studies. And that that again and again, we're not seeing a link between prostate cancer and testosterone. In fact, even if you just look at it conceptually, like, prostate cancer comes on later in life, men's testosterone levels are low later in life. If anything, people are looking at estrogen levels, dihydrotestosterone levels, other levels, and their relationship to certain prostate cancers. And then on top of that, the probability of cardiovascular disease taking your life is much higher than a prostate cancer taking your life. So there's some things to think about to balance out. And I'm a middle of the road guy when it comes to hormone replacement therapy too, although it may not sound like it from this presentation. But those of you who are my patients or know me kind of know my deal. And maybe this speaks to the point, right? Why would I put a slide like this in here if I wasn't kind of like treating the whole person? So what else could it be, right? If you're like, oh man, like you look at those 7 dwarfs of aging and you're like, I got 4 of those, like that sucks. And then you like listen, you're like, man, like Silberman just kind of like making me feel a little on edge here because I'm like feeling that stuff. Like, is it my testosterone? That kind of sucks. It could be tons of other stuff, and so, one of the things about getting worked up by, a functional medicine trained naturopathic doctor who's into this stuff, who's, board certified, who nerds out on it, is that we look at a lot of the other things it could be, right? Low thyroid function is, fatigue, hair loss, challenges maintaining muscle mass, increased fat. Like that's also, we could give the talk on hypothyroidism, and that would be the first 4 slides. So, you got to look at that, especially before you just go and get some testosterone injection. What if your levels are 700 or 800 and it's your thyroid? Or what if it's your cortisol production, right? What if you're, in a high stress environment, you've been in a high stress job for a number of years, your sleep's off, and your rhythm of cortisol production is non-functional. You're going to have fatigue. You're going to maintain that spare tire belly fat. That's like hallmark cortisol deficiency in men and women. So, there you go, right? That's another one of the dwarfs. We got to make sure that isn't contributing. Growth hormone deficiency, especially in our military or our athletes who have had a history of concussion. Growth hormone deficiency is very common, not normally checked on men's lab work at all. Well, at least not in the normal population. In the athletic population, it's absolutely looked at. And it's not like it's expensive. It's just what it is. Nutritional and lifestyle imbalances absolutely play a role in testosterone function. Sleep apnea, I like to talk about a lot. Snoring, improper sleep, inadequate sleep is a cause of low testosterone, and low testosterone is a cause of challenges sleeping. So it's an interesting dynamic. The same thing applies to cholesterol levels. If you have abnormal cholesterol levels, it can be associated with low testosterone. It could also be contributing to your low testosterone. So, you come up, you pop off for elevated blood sugar and cholesterol on your annual blood work because, knock on wood, your doctor is actually looking at that stuff on an annual basis. It could actually be from testosterone production, low testosterone production. So you got to look at it. You got to look at it as part of the whole picture because there is this, it's not a one directional relationship. It is a bi-directional relationship. And that's consistent with a lot of stuff in the human body. And then there are key nutrients that go into making testosterone. Testosterone is made from cholesterol. So if you're not having healthy fats, or your cholesterol metabolism is dysfunctional, that can impact, your levels. It's like trying to get water out of an empty water cooler, right? No water, no matter how much you pull the spigot. And then there's a number of predisposing health conditions, like we talked about some of them, insomnia, traumatic brain injury. ACEs are adverse childhood events. So that's sexual trauma or a wide range of things, even bullying. You would think that, looking at what the screening is for adverse childhood events, there are things on there that you probably wouldn't think of initially, which is why we do them with our patients. But like bullying, for example, is one. Like if you felt like you were bullied, like that's a point. And I know I got bullied. I was a big boy. I was the same weight from when I was in 6th grade to when I was a senior.
Dr. Silberman, can you?
Go ahead.
We have a question.
Sure.
What box should Dr. Silberman check on my blood work that would ensure that we check for growth hormone deficiency?
Yeah. So the most common one to look for is IGF-1. That will give you an idea of levels of growth hormone in your body. All right. Let's keep cruising so that we can get to more questions. So here's the deal. So this is kind of where I like to give people a lot of empowerment education, because if you don't know, then you can't do anything and you can't track progress. So what you can do is anthropometrics are markers, biomarkers that you can look at from your body, not your blood. So BMI is a index of your height to weight. If your waist to hip ratio is one indicator of your metabolic health. It's basically, literally, you can look it up and you can do it at home. It's literally like you take a measurement with a measuring tape of your hip and your waist and you divide them and they give you healthy ranges. Bioimpedance analysis is what I was talking about earlier. It's the machine that we're going to get in the office in the next couple of weeks that can evaluate your muscle to fat. But like, look, you could do your waist to hip ratio and get something really, really tangible too. VO2 max is another one that I love VO2 max because I have a really good VO2 max. It's about your metabolic output, but it's something that can change with exercise adjustment and can impact your, impact your testosterone levels and your longevity. Bone density, especially if you have a history. Guys get bone density scans too to look for early onset osteopenia, osteoporosis, especially if you have a history of any type of irritable bowel disease, Crohn's, ulcerative colitis, where nutrient absorption could have been impacted, negatively impacted, or you have a history of alcoholism. The amount of men I screen with history of alcoholism that end up with osteopenia in their 30s or 40s is very high. It's staggering, and they would never know because no one would look. And here's the deal. Shocker, I think it's $80 cash through imaging healthcare specialists. It actually might be cheaper. $80. I mean, and sometimes your insurance will cover it, but it's amazing, right? And then we'll do cognitive performance scoring for patients. There's a number of online tools you can use for that, very effective to track. And then here's your labs. Like, this is what I would recommend getting looked at as part of your evaluation, right? Sex hormones, because we're talking about testosterone, but also looking at sex hormone binding globulin, estradiol, and I would add dihydrotestosterone to that. If it's not in one of the previous slides, that's a DHT. Growth hormone, here's your IGF-1. An adrenal panel through blood is cortisol and DHEAS. There are also saliva tests that look at your cortisol throughout the day that I find to be very effective too. Looking at your blood sugar, so glucose, insulin, and A1C, which is hemoglobin A1C. We spoke about the relationship between testosterone and hemoglobin A1C in the previous slide, as well as the lipid panel. I like to get a more comprehensive lipid panel. It's called the NMR profile. You could literally print this slide and take it to your doctor and they could fill it out, their lab requisition, and you get all this checked. You check it fasting, so that means at least 10 hours, no food. And you get an idea of these different areas of your physiology and where there might be some functional deficiencies or pathologic. So then the question becomes, okay, so you do this workup with your doctor, your functional medicine doctor, you dial in everything, Your lifestyle is perfect. You're meditating with your guru every day. You're doing high intensity interval training, you're squatting, you're doing all your stuff, right? You got your heart rate variability tracker, and the whole deal. And then yet your testosterone is still kind of low or suboptimal. Like, what are some opportunities where we can intervene? From a lifestyle standpoint, we know that high intensity interval training, which is the HIIT there, absolutely boosts testosterone. It also boosts a hormone in your brain called BDNF, brain-derived neurotrophic factor, that increases neuronal connection in your brain. It can also stimulate growth hormone production. So you'll see IGF-1 levels go up. Sleep hygiene, having appropriate sleep, and stress management, mindfulness play a big role in testosterone therapy. I make sure these things are dialed in with all my patients before doing anything, because otherwise you don't have a clear picture of what's going on. There are herbs that absolutely have been shown to improve testosterone levels in serum and blood tests. I put 3 of them on here, but there are a couple more. But maca, tribulus, boron, I would say ashwagandha is another one that they're great. And many times they're enough. They do it for men. There are medications that are safe and effective at boosting a man's own production of testosterone. Like we saw in that feedback loop drawing before about the creation of testosterone. When we give testosterone to a man, one of the things it's going to do is it's going to naturally decrease your own production. Now, look, if you have the inability to produce anymore, that doesn't matter. But like, say you're in your 20s or 30s, and you might just need a little stimulation to increase your own. That's where herbs like maca or ashwagandha can play a role. That's where medications like clomiphene citrate or HCG can play a role. That's where peptides like kisspeptin or gonadotropin or some SARMs that we can talk about in more detail, in the Q&A for sure. That's where we'll squeeze the. That's actually not a good analogy. I don't want to talk about squeezing any test. We will nourish and poke. No, can't say poking. We will nourish the feedback loop. We will push the pituitary gland to secrete hormones to your testicles to make more testosterone, and then we will see what happens. And in my mind, that's a very important step in the process of working up a man with poor testosterone production. It's like, look, sometimes all they need is a little bit of facilitation, and then we can actually stop it, and their levels just kick on, they maintain. And then, sometimes people need testosterone replacement, and these are the different kinds. So maybe, Chris, you want to talk about the different types?
Yeah, sure. There was a question, Doc, and just to let you know, we have about 45 minutes.
Yeah.
What do you think of micronutrient testing? And then I'll jump into this slide.
Sure. I think micronutrient testing is valuable when someone's diet and lifestyle is pretty optimized, and we're trying to plug holes, right? There's really no point in doing a micronutrient panel if your nutrition isn't yet like up to snuff. Like, if you're eating a ton of food that you're sensitive or inflammatory to, or you're drinking a bunch of alcohol, or your eating window is wrong. I think once your kind of general nutrition guidelines that everyone agrees to are optimal are kind of in place, and then we want to take it to the next level, I find micronutrient panels helpful. Some examples of that is I work with a couple of sports teams here in town. Can't say who, but we'll do micronutrient testing with them, and we see that their performance improves, right? Like they track a 40 is something that certain sports track, right? How far you can run a 40, how fast you can run a 40. And we see incremental improvements with the micronutrients. We see improvements by like half a second in nutritional. So I find it valuable. I try to kind of use it once we hit a certain level of nutritional optimization already.
Okay, great.
Yeah.
So once the doc decides, yes, indeed, it is your testosterone, how do we replace it? There are multiple ways, and there's pros and cons to all of these. So I would say that by far the most common way we can deliver testosterone is through the skin. So in a cream or gel, easy to use, pretty cost effective. And most people, we get a good level on most men and women both. And cons, and sometimes with the guys, there's body hair, and that really can impede absorption. So it's really important to find a place on your neck, bicep, shoulder that doesn't have hair. Sometimes it may mean you need to shave an area. The bigger the surface area, the better when you rub in these things. So, and don't try to just keep it in one little spot, rub it around and rub it in a good 20 times or so. Wash your hands, because you can transfer it to pets and babies and partners. The pellets I get questions on, we can make them, we don't. You know, they're convenient. They get put in and you don't have to think about it, but it's invasive. There's actually cutting involved, and it's hard to control the dose. I think it's much easier to get a steady state when you're doing a cream or a gel topically, because when the blood pulses through, it pulls a little bit out, and you get a nice steady state. With the pellets, there's a big bolus dose in the beginning, and then they're just over time starts to wean away and lose its potency, and you don't really kind of know where you're at when you're 2 months into it or so. And then you go on to the other side of that 2 months, and we get a lot of reports of, I'm just wiped out, but it's not time for my next pellet yet. And they are expensive. They're done in the doctor's office. Injections, they work and they're cost effective. That's the route I would typically recommend. If you've tried the cream and we're unable to get you to a therapeutic level, then of course we have the injection to go to. The cons, they can be a little painful. It's a thick, viscous, oily liquid with a thicker needle because of the thickness of the liquid. So, but it's usually once a week, once every 10 days or so. By the time your next injection comes around, you're ready for it, because it's kind of like the pellet starts to lose potency over time. But it is a really effective way to get levels up quickly. We also have some sublingual tabs and sometimes a sublingual suspension. And these are kind of great and fun to do right before sexual activity, 15 minutes or so. Gives you a little boost right before sexual activity, but it won't necessarily build a level, and they're kind of expensive to use. But we do have some people who use these kind of things in conjunction with testosterone replacement therapy also.
You want me to talk about this one?
Yeah, go ahead, Doc.
Yeah, sure. So some of the things that we see when using testosterone therapy, which are ubiquitous to all forms of administration, are we do see sometimes a shrinking of the testicles, because, like I mentioned, you know, you're cutting off that feedback loop to your testicles to make testosterone. So you're going to get a shrinking of those glands that do that. Testosterone can result in thickening of the blood. So it's really important to keep an eye on your red blood cell count and your hematocrit and your hemoglobin when you're on hormone replacement therapy. And, you know, usually the response to that is that we, you know, have you donate blood at a certain rate based on, you know, how fast that's happening. And then, yeah, you know, I'll only see acne in men on testosterone replacement therapy that are on too much. They're too high, or their dihydrotestosterone and their estradiol aren't being managed. So, you know, whereas the testicular shrinkage can kind of happen more, you know, it can kind of happen a little bit to a varying degree for most guys. Thickening of the blood's going to happen eventually if you've been on it for a long time. The acne, I don't really see that. I really see that really when people are maybe over medicated, or the other hormones that we need to manage when on testosterone replacement are not well managed. And then just as another reminder, you know, at this point in the literature, it's not 91 anymore, it's 2020. And every year we see more and more evidence that in fact the opposite is the case. It does not cause prostate cancer, and in fact, healthy levels of testosterone can be cardioprotective. So this is another slide that you can think about when discussing, say you're on testosterone replacement therapy with your doctor now, and you want to kind of be like, oh, how do I manage this more appropriately, or how do I manage this the best way? the most comprehensive way. This is a good slide for you because your lab work that you check on a regular basis when you're on therapy should include obviously testosterone, and that's total and free. It should include estradiol. It should include dihydrotestosterone, sex hormone binding globulin, your blood counts, which is the thick blood that we were talking about in the last slide, and liver kidney function. All of these are very easy tests. All doctors know how to order them. They can all order them for you. The reason we look at these markers is obviously we look at testosterone to make sure your levels are appropriate. And there's an appropriate time to test those levels based on the route of administration, right? If you're doing pellets, you're going to check at a different time than if you're doing injections, than if you're doing creams. Testosterone in the body will convert to estrogen, and testosterone will also convert to dihydrotestosterone. And we don't want either of those markers to rise because they have their own associated side effects. So we use either herbal medicine or medications to keep them in check. When sex hormone binding globulin, the SHBG, there is elevated, you're going to bind up testosterone in your blood and not allow for it to actually become free and activated. So there are strategies that we can use to keep your sex hormone binding globulin within a normal range to allow for the testosterone that you're using to actually be effective at a cellular level. Then some other ideas for yourself, if you're on testosterone therapies, to consider cycling therapies, depending on where you're at, meaning maybe you do some testosterone and then you cycle off and you do something like clomiphene citrate to try to boost your own for a little while. And you cycle back on. We want to make sure that liver metabolism is optimized as these hormones are being metabolized and excreted through your liver. It keeps you safe. Then obviously the lifestyle factors like we spoke about before and the role that they play in testosterone production is important. And then there are some genetic precursors, some genetic predispositions that we can see in your genetic testing that may impact or set expectations, I would say, as to how effective certain therapies are going to be. So it's a nice thing to look at. Yeah, Chris, you want to say something?
Another,
Another question?
I think it was,
yeah.
I'm gonna drink some.
Do you want me to read it, Chris?
yeah, I can read it. Where was it? Any risk of thrombosis because of the polycythemia or the blood thickening, or if you donate, no issue?
If you donate, no issue. And yes, which is why we monitor it for sure. And the thing about it is if you stay on top of it, then you can donate. But if your levels get too high, the blood bank won't accept your blood, and you got to do something like come in here and get phlebotomy where we suck a bunch of blood out of you. And that sucks because no one gets to use that blood. So I like to get guys in a routine of donating blood based on how their levels are changing so that we stay ahead of the curve and we never have that issue. But yeah, absolutely. There is absolutely that risk. So one of the things that we pull out for guys, it's a big issue that's, testosterone related, but can be related to a number of other things, is libido and erectile concerns, right? ED. I think there's a lot of ads on TV I hear from my patients about this thing too, this thing called ED. Like Chris was saying, sublingual tablets or drops before sexual intercourse can absolutely stimulate an erection and also just the feeling of climax and sexual stimulation and gusto and drive. And it can be used on top of testosterone replacement or other things because it doesn't sustain it. It goes in and then it leaves. Probably by the time you're finished and snuggling. Something like sildenafil is Viagra, and then there's also Cialis. There are oral capsules of those medications. There are also sublingual tablets that work a little bit more quickly that can be compounded for you. They can be combined with herbal medicines like oxytocin or glycine to try to sort of stimulate sexual activity, sexual function. But, most people will go to some Viagra or Cialis because they've heard them on TV, and now they're both generic, they're cheap. But yeah, like I think when you add in a little testosterone or some herbal medicine, it makes it spicy for sure. I mean, you could probably talk a little bit more about stories. You probably hear more, but I mean, I hear the stories all the day, but
Yeah.
so there's a lot we can do here to not only just get the erection up and maintain it, but to like make the sexual experience more engaging for you as you age. And like I mentioned, like in these pillars for health, like sex is a pillar of health. Absolutely. People just don't put it out there because it's taboo to talk about it, but not to me. I want that to be what it's meant to be every stage of my life. So yeah, I wish that for all of you. I wish that your swagger maintains, as the young folks say, and that you have gusto for life, and that we do that as naturally as possible, and that you guys get the type of support that is appropriate for you. You want to talk a little bit about the compounding aspect, Chris, and why it's so important?
Right. I mean, you talk about replacing safely and naturally as possible. That's kind of where we come in, because we're able to not only customize specific strengths and dosage forms, but it's bioidentical, the testosterone we use in the creams and the gels. So that means it looks exactly like the testosterone in your own body versus synthetic, that the body has a harder time to metabolize and get out of the body. So that's kind of that lock and key mechanism. This lock fits this key. Your body kind of sees it as its own testosterone and knows what to do with it. It's like it's on board, it gets it. So everything that comes to us in a compounding pharmacy is by prescription from a doctor. We are highly regulated by the FDA, the boards of pharmacy, all the boards in the states that we're licensed in. We're licensed in many states. We're also accredited. I think that's the next slide, Doc.
Sure. How did you know?
Might have done this before. We are accredited, PCAB accredited. Less than 1% of pharmacies have that level of accreditation. We're accredited for sterile compounding, for non-sterile compounding. Everything we do is sent out for batch testing, so that when doctor prescribes a testosterone 10% cream and your levels are too high or too low, he can actually with confidence make an adjustment, knowing that you really did get testosterone 10% cream to begin with. We batch test, we send out for potency testing, sterility testing, endotoxin testing. I want to sleep at night. Doc wants to sleep at night. We want the patient to feel the best, their best. So it's on us to bring out a quality product. We don't, all our hormones or all our chemicals, all the chemicals come from FDA approved chemical houses. We have intense training that has to happen when you're accredited. Everything's at a higher level. So the equipment's at a higher level, and they can walk in at any time and inspect us, and they do. So we have to be ready to roll. We have to have our processes in place and implemented and doing it every day, day in and day out. So we keep patients safe and make a quality product.
It is true. I've been on the phone one or two times, and they actually come in and she's like, "Oh, Adam, I gotta go." I don't know if you remember that, but I do. But anyway.
Oh, yeah.
And we have a question here, Chris.
Okay, let me see here.
Yeah.
Okay, as a question, Doc, with proper screening and medical evaluation, is there any contraindication to initiating testosterone therapy in patients that are in their 60s, 70s, and 80s? Great question.
No, absolutely not.
Yeah.
But the key answer to that is proper evaluation. So, if you have a family history of certain types of pathology, we just want to make sure that we understand what's going on. But no, absolutely not.
And there's an argument to be made that you're safer on it than off it.
Yeah, especially if there's a cardiovascular disease risk in your family. Yeah.
Bone density issues.
There is an argument to be made for sure. But each person is unique, and every year we get more and more information. So right now that's kind of what we think, but you never know. what could change. But yeah, so I would say no, absolutely not. This is your tip. This is like the slide that you kind of, whenever you talk about hormones, you just sort of have to have somewhere in the slide, the presentation. So like we kind of put it in at the end. But
this is the little baby version. This form would normally take up a whole wall.
Yeah.
This is a broken down tiny version. And honestly, we put this in here there's a thing called balance. You have to have balance. You can't just bowl ahead and give testosterone and not know that testosterone can break down to estrogen. And are you monitoring estrogen and estradiol levels, things like that? So it's important to go to a doctor that really understands this. Again, prescribing and writing testosterone on his prescription pad is a 10% of the problem solved. 90% is testing and follow-up.
Yeah, I mean, I do see now that there are these testosterone clinics around that are called testosterone clinics. I do see patients that are over medicated. Absolutely. I mean, I'm sure their physicians are great. I'm sure they're doing an excellent job, but they're busy and it's quick, and just the name in itself is going to lead to that sometimes. So, and I'd suggest that it's a little more complex or dynamic than that. And more personalized approach for most people would be warranted. Yeah. All right. So you want to talk about this one, Chris?
Sure. So does anybody have any other questions? We're coming to a close here, and then we're going to do some giveaways.
Yeah, this is it.
Yeah. So if you think of a question, throw it in the chat while I'm talking here. But I really applaud all of you for getting on the call tonight, because honestly, I don't think we give our guys enough attention and love. And honestly, I think typically in most families, women are the seekers of healthcare. So it's important to take care of yourself and feel better. You don't have to keep feeling how you're feeling. If you felt that exhaustion and the weight gain and can't build muscle and low libido and all those things, it's really normal at a certain age, but it doesn't have to be that way. So we are living longer than we ever used to be. Gosh, 100 years ago, men and women died in their, at 58 or even younger than that. And now we're living into the 80s, and we have to supplement judiciously and by testing and follow up. But we can do it as safely as possible and keep you feeling vibrant. It's not just about living longer, as you said, it's about living better longer. We don't want you laying in a nursing home in bed for 5 years. We want you out playing tennis and walking your dog and having good sex and just living a vibrant life. So that's what this is all about. It looks like we have a couple questions came in, Doc. Oh, sorry. No, okay, let's see. Okay, full disclosure, my husband is working late and I'm attending this for him. Well, way to go. I love it. That's love. We have struggled with fertility issues for years, but they told him his sperm count is fine. But we know for a fact that he has low T. Can this still be the cause of the fertility issues, even if sperm count is normal?
So it can be contributory. Yeah, it can contribute to it. What you wouldn't want to do is give testosterone, because testosterone replacement will reduce your sperm count. But something like clomiphene citrate could be an option that you could discuss with your fertility specialist to support, especially if you're engaged with someone and you've been having challenges already.
And clomiphene for the man, not the woman.
For the man, yeah, clomiphene for the man, exactly, yeah. Clomiphene originally was used in fertility clinics to boost testosterone production and sperm quality as well. But yeah, it could absolutely be contributing. I would also look at, some of the other factors. Many times when people are struggling to conceive, it's the guy. Because everybody focuses on the girl for the longest time. So yeah, there could also be some other issues there too. Timing of intercourse, vaginal pH is another one that I see a fair amount that doesn't get enough attention.
Right.
And then also male pH of sperm. So yeah, I would be happy to discuss that in more detail for sure. If you want to give the office a call, give you some feedback to support you and your doctor, or come and play, in the team.
Okay, so another question, Doc. Can testosterone replacement therapy cause balding?
No, only if your dihydrotestosterone is unmanaged would it be conceivable that testosterone replacement therapy would be associated with hair loss, right? As we know, high levels of dihydrotestosterone have been associated with that male pattern balding, which is why we use 5-alpha reductase inhibitors to help people grow their hair back.
So potentially it could be if it goes unchecked, because testosterone
for sure
does break down to DHT.
Yeah.
That's why you're measuring DHT.
Exactly. Yeah. Not in my clinic. Yeah. If you're on replacement therapy and your dihydrotestosterone is high as a result and it's unmanaged, you could absolutely have hair loss associated with that, for sure. But if your dihydrotestosterone is managed with a combination of herbal and pharmaceutical approaches and that level's within a normal range, then it's not typical for that to happen.
Doc, can you just go back one slide real quick? I just want to make sure I hit everything.
This one?
Right. So how do they work with you? If they call and make an appointment, what's that process?
Yeah, so we take pretty much all PPO insurances.
And that's mind-boggling, because doctors that do this, I'm going to jump in right now. That's what makes Center for Health and Wellbeing so unique. That they give this high level of care that everyone deserves to have, and it will build more PPOs, which most of them do, because you spend a lot of time with your patients. It's not a 10-minute visit.
No, initial consult's an hour,
right,
and follow-ups are usually 45 minutes. Yeah, it's a bit of a salary sacrifice for me. Like I could be doing more high-end stuff, but I believe in the center, and I believe in building a team of naturopathic doctors that operate in this way, and I believe that this model can really change the health of the community. So that's worth it to me. That's more valuable to me than money, and I want to help more people. So the fact that we take insurance, I spend more time with my patients, 45-minute follow-ups, 60-minute initials. If they need a 60-minute follow-up, I give it to them, absolutely. So that we all are educated on why we're doing what we're doing. And yeah, I think we're probably, as far as I know, we're one of 2 centers in California that take insurance for this type of medical care.
Right.
The other one's up in Irvine, UC Irvine, Samueli Center.
And we have this jewel in our backyard. Plus, you guys, I know, discuss patients among providers there, and you can be referred over to massage or acupuncture or to an MD if needed. You have the whole package, and so I love to tell people about this place, because I just think it's a phenomenal that we have the Center for Health and Wellbeing in San Diego.
Oh, that's really sweet. Yeah, it's easy. Not very many people say insurance can be easy, but it's about as easy as it's gonna get to use your insurance for IV therapy, acupuncture, chiropractic, because basically once you're onboarded into our center by seeing one of the medical doctors here, you basically get access to all of these services through your insurance. Like it's just done. You don't have to go to a different office and have a different biller and have to deal with all this other stuff. It's all in-house, which makes it easy, the easiest it's going to get, which I love. I mean, it's another reason why I really like working here. Yeah, I like hearing the perspective of an acupuncturist on a patient's care. It's cool. I learned so much. Cool. And we can work together, and we get team-based medicine is where we get strategy, and you really want a good strategy for your health. It's probably the most important thing.
Another question, Doc, is there a typical age men go on TRT, testosterone replacement therapy?
You would, if you had to put an age to it, it would probably be somewhere in the mid 40s or beyond. I will do my best with my male patients to hold off on testosterone as a therapy for as long as possible, using lifestyle, herbal medicine, medications like clomiphene citrate or HCG, peptides, until we reach a point where those are no longer really doing it for us. Then I'll pull in the testosterone replacement. But then there are those exceptions, like we spoke about, with especially individuals with traumatic brain injury or a significant history of traumatic events that in which their testosterone has shut off in their 20s or 30s.
Right. Okay. All right. Well, I think that's all the questions. I encourage all of you, if this resonates with you at all, to get in and see Dr. Silberman or someone in the practice.
Yeah.
They're awesome. You're going to get heard. You can talk. He's obviously easy to talk to. So thank you, doctor. That was wonderful. Helena, I think we're giving away a couple of Myers cocktails from Center for Health and Wellbeing. That's what I heard.
Correct. Yes. So I'm going to do the drawing right now. Okay.
Can I compete, or do I get to compete, or am I excluded?
I think you're excluded, Doc.
Fair
You're
enough.
excluded.
You and I are excluded.
All right. So the first winner is Bob Suklo.
Ooh, cool.
Is Bob on the, okay.
And we'll do another one.
He actually has a spinner.
Yeah, that's awesome.
Ashley Alexis.
Is that a clap?
Yeah, there's a clap.
And Lavita is giving away a visor and a hat. So let's,
That's good stuff.
Some Levita swag.
yes,
I love the Vita swag.
it's for Nathan Henner. Yeah.
Yeah.
All right, Nathan.
For the visor. Yay. You can hear the spinning, right?
I can hear the spinning. I know, it's like that.
Oh my gosh. Oops. It is Julie Gubbard.
Julie Gabbard. All right, we know Julie. Congratulations, Julie.
Yes.
A little Levita swag. All right, I think that's all our giveaways, right, Helena? And if you guys, I just really want to thank you for coming. Keep an eye on, if you go to LevitaRx.com, we have all our calendar with events. We do these events for women, wine, women, and hormones. We'll have more of the Boys and Brews coming up as well. Again, in the era of COVID, it's a whole new world. You sit in the comfort of your living room in your pajamas and hopefully have an informative and fun seminar you can watch or webinars. So Doc, thank you so much. You were wonderful as always.
Oh, good. Happy to have you.
Pleasure. And I guess that's it. No more questions. Thanks for being here, you guys, and we'll see you again on the next one. Okay.
All right.
Bye-bye.
Bye.